Thank you, Chair. My name is Samantha Gibson. I'm a Government Affairs Associate at the Michigan Association of Counties. As stated, I'm joined today by Amy Dolinky. She is MAC's Opioid Settlement Technical Advisor. She serves all 83 counties in Michigan. And with that, I'll turn it over to Amy to talk about her work across the state.
Thank you so much for the opportunity to be here. Again, Amy Dolinky with Michigan Association of Counties. So my position was created to really provide technical assistance and support to all of the counties in the state that were interested in receiving that support related to planning and spending of their opioid settlement dollars. At this time, 66 counties have engaged in some capacity with our technical assistance efforts. Outside of the technical assistance and direct support or individualized support that's provided to counties, we've also created numerous tools and resources to support counties along this process. So we've developed a guide for local spending, a toolkit, a resource library. We do have our resource center website, which houses a dashboard that has information about expected dollar amounts for each county, as well as an understanding of our baseline assessment, which was rolled out last spring to gauge readiness for spending and what counties were anticipating doing with their planning efforts in order to appropriately spend these funds. And so with some of those supports that we're providing, the technical assistance that has been requested has been very varied. So we've provided administrative support to some communities. Other communities have requested ongoing strategic planning efforts and really a wide variety of activities, including advising on allowable uses or recommendations related to proposals that have been submitted for funds. At this time, most counties have not yet spent funds, and that is really based on the fact that they are deeply engaged in their planning efforts and stakeholder engagement at the local level, really pulling on their local experts, understanding their local needs, and working with additional technical assistance providers as well to support that. So across the counties, again, we haven't really seen a ton of that spending take place yet. I do anticipate that we will see more of that within this year based on what we're seeing. So most counties have developed a steering committee, a group of local experts to be able to guide their process. Some of the tools that MAC has provided are template resolutions, template requests for proposals, template contracts. So many different things to be able to support them and streamline and formalize those processes. We also are seeing some key trends when it comes to where folks are looking to spend funds. So we're seeing an interest in primary prevention, seeing an interest in expanding recovery supports, addressing things like transportation as well. Also linkage to care and coordination of services. So we know that in many communities there are a lot of services available, but those efforts may not be as coordinated as those communities are hoping to see. We're also seeing interest in expansion of specialty court programming, increased naloxone distribution or pathways to distribute naloxone, and really addressing the drivers of health. And MAC is also committed to an annual voluntary reporting survey for the counties, and that survey will be administered this spring. And the information that is collected from that survey will also be housed on the dashboard on the Michigan Association of Counties Opioid Settlement Resource Center website. So we are anticipating looking at both how folks are planning, who was engaged in the process, and potential for folks to report on expenditures that were in alignment with both Exhibit E, the allowable uses, and the definition of opioid remediation. So I think that pretty much covers a bit of where we're at and the supports that MAC is providing, but happy to answer any questions you may have.
Can you elaborate a little bit more on the dashboard and talk a little bit about what that entails and how that's helpful as a resource to us as legislators as well as the counties in totality, please?
Yeah. Absolutely. So on page 3 of the written testimony that was submitted, you see a screenshot of the first 2 pages of that dashboard. So the first page that's titled Funds outlines expected dollar amount by county for each settlement. This does not include city funds or township funds that may also be coming into that county. On the bottom left of that dashboard, you see a breakdown of how much money is going to the state and how much is going to locals. And then the bottom right corner, you see the maximum number of payments for each of those settlements. The second tab or second page of that dashboard really looks at who is engaged in technical assistance with MAC. Again, the capacity in which they are engaging with MAC's technical assistance is varied, but it does really highlight that most of the state is engaged in some capacity, as well as the amount of technical assistance requests that have come in on a monthly basis. If you go to the engagement, planning, management, and strategies pages, that is really where we have housed the data that is connected to that baseline assessment in terms of readiness for spending, that survey that was rolled out last spring. So those last 4 tabs will be where the information is housed that we do capture in that annual voluntary reporting survey.
Is there any continuity with other states that have received opioid settlement dollars as to how to support their communities? Or is there like best practices that you have seen with other states that are also doing this work as far as collecting information based off the dashboard? Or
So what we're seeing in Michigan in terms of the support that's available to local governments, counties specifically, is really unique here in Michigan. So in many states like North Carolina and New Jersey, the folks that are providing support to local government are actually housed within state agencies. We also see that there are, Kentucky just hired a position that is the same as my role, here in Michigan with their association. So we do see that this looks really different from state to state in terms of what types of support are being provided. The National Association of Counties does have an opioid solution center where they're able to highlight evidence-based strategies that have been effective, and they're also putting out some briefs on how counties can really implement the Bloomberg Johns Hopkins principles around opioid settlements.
I guess, do you have a question? Okay, I'll give somebody else a chance to ask questions here. Senator, go ahead.
Thank you, Madam Chair. Thanks for your presentation. I'm curious, you talked a little bit about the rollout and that various counties are in various stages of RFP and that kind of thing. When do you expect to see implementation, maybe early adopters, average, and when do you expect to see the latest ones develop their programs?
So what we know right now is that every county is really doing this differently. So the process is not the same in any county, whether that's who's leading the settlement efforts, who is facilitating a steering committee, if a steering committee exists, and what that process is for rolling out those funds. So some may not have a request for proposals process, while others do. We've seen a few counties already start spending as early as 1 month after they received those funds. Those funds were initially received by the counties on January 31st of 2023. So I think they're going to continue to be at varied stages. It really is important to understand the capacity of that local government and that local community. So some communities that may have had an existing task force or coalition that was working on the opioid or drug overdose crisis issue for the last 5 years or 10 years, those communities have a different level of capacity in understanding what the needs are, understanding how to move forward, and some other communities do not have that existing infrastructure, as well as looking at the capacity within county administration.
Senator McDonald-Rivet.
Thank you. I think my question is twofold. The first, the idea that every county is handling this differently, to me, borders on the absurd. Right? That we are recreating the wheel and starting from scratch with each municipality in something that is so pernicious in our state. So would love to understand the why of that, but it gets to the core of my question when we think about deploying technical assistance around best practices and things that work, which we need to do with some urgency. Is there some sort of, and maybe the department will answer this, but heat map that's late. I mean, so what if we are in a space where we have the worst problems in a county with the least capacity? Are they left to their own to scratch it out? Or how is this, spreading it like an even layer of frosting across the state and letting everybody just figure out what they're going to do individually doesn't feel that affected to me. So just wondering if you can respond.
Yeah, so in January of 23 as well, MAC rolled out the toolkit, the Guide for Local Spending, which is really a process document that focuses on stakeholder engagement, gathering local data, understanding where the capacity is right now in order to move forward, and then focusing on accountability and monitoring. So the hope would be that communities are able to function within their own capacity and with their existing infrastructure to be able to still conduct some of the same activities like community needs assessments, strategic planning, and thinking about transparency and how that works in their community. But I do think that each area has had their own existing work, their own desire to really do this a different way. But what I have seen across all of the counties that I'm working with is everyone is extremely committed to really helping people the best way that they can, as well as a commitment to transparency in their process.
100%, right? 100%. That the thing that I am absolutely not questioning is desire and intent and the fervent way anybody I talk to around this issue is borders on desperation to fix, right? Because it's so terrible. But I just, and maybe, I think this is a question that I'm just giving a key that I'm going to ask the department about. Hope isn't a strategy. And I hear a lot of process stuff. But in the communities, the county I live in has one of the highest overdose rates in the region. And so, I'm just really curious about what we're doing in places where there isn't a capacity. We have underfunded local governments for decades. We have a history, a couple of decades of dramatically skimping on public health and the infrastructure associated with public health. So I'm just, technical assistance is great. The work you guys are doing, it sounds fantastic. But it's a much bigger and much deeper problem than working on this through the counties in this way.
I think I'm just going to segue to what she said. Where are these services duplicative? I mean, obviously, not all substance abuses are created equal, and obviously this is a different issue as far as the dollars that are going for the opioid settlement. But my question is around where potentially is there an opportunity with what we see on the ground currently with our substance abuse facilities to help support that, where there could be an expansion of that capacity, or, obviously for those municipalities to support those agencies that are already doing this work on the ground in other areas?
So most communities that I'm working with have not at all talked about starting new programs. Most are focused on understanding what the current landscape is in terms of who the service providers are, what services are being provided, even when their current funding is slated to end, to really understand the full landscape in which they are functioning, in which they are making recommendations or choosing where those funds go. So most folks are really just looking to expand existing programs. I'm not seeing much interest in starting new programs, and I think that's mostly related to the fact that while these dollars sound like a lot, when the counties break down how much money they do have per year, they recognize that the amount of funds will not be able to end the overdose crisis.
Senator Hawk.
Yeah, I have, excuse me, thank you. I have a lot of rural counties. Can Isabella and Macasa County pool their money together to have one center? I guess what I'm trying to say is maybe there's one center right now that the counties use that's doing an effective approach. They could say, we're just going to give the money to that entity.
Absolutely. They do have the ability to pool funds in numerous ways. So townships and cities can direct funds to counties. Counties can work with other county governments, tribal governments. There is the ability to work across governments, and MAC has absolutely talked about that with many of the counties. As we've seen the process take place, I'm only seeing a few areas, specifically rural communities, have the most interest in pooling funds, although I have not seen any funds pooled at this point.
I agree with my colleagues. I think what we have to watch out for is whenever there's a pot of money, everybody means good, but everybody thinks they need to have it in their district, right? And I don't know if there's some way we can make sure that it's being used effectively. Thank you.
Senator Huizenga.
Thank you again. One of the things I was thinking about is that in my area, my district encompasses both Kent and Ottawa counties, and people in that area consider themselves parts of Metro Grand Rapids. Is there a push for consistency in the way resources are deployed between those two counties so that our constituents don't see these invisible lines and recognize, like, well, things are completely different from one county to the next? And this would apply to probably many metropolitan areas with greater density where those counties cross over. Does MAC provide, you said templates, but does that help ensure that things are being delivered and deployed consistently between these metropolitan areas and different counties?
So we have really suggested some sort of partnerships, whether that's pooling of funds or just sharing of information, and especially keeping information transparent. We've seen a lot of counties develop websites recently, or websites are in development, so that way other folks know where they may be able to tie in, or where they may be able to have a better understanding of what's happening in the surrounding areas. My role is really to advise. And so being able to kind of direct some of that work would be outside the scope of my role.
And just one follow-up question. What percentage of the funds would you say are going towards admin, like development of these websites and resource planning and things like that, versus actually being used for assistance in this crisis?
So because most funds have not been spent yet, I can't say exactly what that would be. What I am hearing in terms of ideas and thoughts are either a 0 to 5% admin rate.